11 babies have been infected with the antibiotic-resistant strain of Klebsiella at Thelle Mogoerane Hospital in Vosloorus, that's east of Johannesburg. 6 have since died of this common infection. The health department has decided to close the hospital's contaminated neonatal and maternity wards and have moved all newborn babies to the Nelson Mandela's Children's Hospital and Charlotte Maxeke Academic Hospital. Overcrowding was found to be the cause of this bacterial infection. But let's get more now from Gauteng's Health MEC, Dr. Gwen Ramakgopa, and she joins us from our Pretoria studios. MEC, thank you very much for joining us here on the program.
Good morning, Leanne, and good morning to viewers.
MEC, can you give us an update on the babies that were moved from the Thelle Mogoerane Hospital? Are they responding to treatment?
Leanne, the important thing for South Africans, especially for the residents around Ekurhuleni who use this facility, is that we are doing everything and taking extraordinary measures to ensure that we deal with underlying problems. And why we decided to divert all new admissions, it's because there are also structural issues that were raised as possible contributing factors for infection control difficulties. It is never an easy decision. It's not an overnight decision, but it's a necessary decision currently.
Yeah.
As we speak, we have established a clinical team consisting of obstetricians, neonatologists, which are pediatricians, as well as the support of the National Institute for Communicable Diseases to implement this intervention. Yeah. We want to assure the people, especially around the Thelle Mogoerane area, that we will do everything to ensure that the surrounding hospitals assist, but with the backup of Nelson Mandela Children's Hospital and Charlotte Maxeke Hospital.
Okay, so let's just get an update, if we can, on how the babies are doing and how are they responding to treatment.
What I can assure the public about is that the affected babies were grouped but in separate beds, and they have started receiving colistin, which is really a high-level antibiotic with other additional antibiotics because it has to be a multi-drug treatment. As we are dealing with a resistant bug in this instance, Klebsiella.
Yeah.
And some babies had begun to respond, and we are monitoring the situation very closely.
Yeah. So we look at the situation, and from some of our understandings is that the outbreak actually started in July. That's been around for quite some time now. Why has it been difficult to contain this?
What happens is that as we are sleeping round the clock, 24 hours, there is a continuous surveillance of diseases in our facilities and also in our environment. And the National Health Laboratory Services and the NICD, National Institute for Communicable Diseases, which is a World Health Organization accredited facility, does that. And when it picks up any increase in any particular infection, they inform us. We put measures continuously. So even Thelle Mogoerane did immediately react. They have already scrubbed down and decontaminated the initial wards that were affected, 5 of them. What I'm saying is that we are now doing further interventions, taking further actions to deal also with the possible underlying factors, because we haven't as yet, with the support of NICD, identified the source.
Yeah, and the difficult part is the overcrowding, and we heard this in the news conference that was held, and the minister talking to the fact that some hospitals are 132% of capacity. In some of the neonatal wards, you find that there are 90 babies, where in fact there should be only about 61 babies. This extreme overcrowding has been something that's been pinpointed as a huge point of concern.
As I've indicated, and I'm happy that the Minister also acknowledged that, 1999 there were about 7.5 million South Africans living in Gauteng, and now that number has doubled to about 14 million. You look at housing, despite the number of houses that were built, there is a backlog. You look at health facilities, despite the number of community health centers that have been built, and the 2 or 3 other hospitals, the demand is higher, is far higher. So the Minister did announce that at minimum, Gauteng needs about 6 more additional hospitals to cope with the numbers. But the additional issue is also the uncounted numbers with the budget that we receive, foreigners and in and out of migration from time to time. But within that context, we must remember that Gauteng Department of Health is also a platform of training. It has a number of centers of excellence. And that is how, even with the demand, I must say that our nurses, our doctors are our heroes and heroines. They are working round the clock to ensure that they provide quality care despite the circumstances. We can't turn any baby away. We can't turn any pregnant mother away. We have to give the best available treatment.
Yeah.
And yes, we have to deal also with the issue of overcrowding. With the NHI, there are also talks about looking at prices that we can set for the private sector extra capacity to be utilized.
Yeah. You know, there's also this issue where nurses are reporting that they're under pressure. There's a lack of staff. There's a lack of equipment. There's a lack of medication. I mean, I receive personal emails from people that write into me, and I'll leave this anonymous, but somebody writing into me and saying that this is a major issue, is that there are no vaccines for babies, that the government-provided vaccines at many of the clinics and hospitals are not available. This one goes on to say most clinics don't have, and if they do have, they only take a few babies, which then means you have to wait again. Our baby has missed it. She's now 4 weeks old. The hospital that they went to was Rahima Musa, and they're vulnerable to having no vaccines. Where's the medication? Where's the help? Where's the equipment? MEC, this is a tragedy.
We do have a medicines availability monitoring system. And overall, in terms of availability of medicine, South Africa as a whole is not doing badly. And where sometimes there is no, for instance, BCG, that is the TB vaccine, you'll find that the problem is with either manufacturer, and we are informed, and the mothers are informed to come later on the specific date as well. So it's a continuous monitoring and management of the situation. But overall, the issue of medicine availability in our country, it is not a major problem. Where there is a problem, we want to invite the public to phone in, to raise it, and we would want to appreciate that so that we can respond speedily. Yeah. In terms of that area. I
think
yes.
that people,
but in terms of equipment,
MEC, sorry,
we do.
Can
I just indicate that?
Yes,
sorry.
Go for it. Please do carry on.
Yes, you also talked about equipment. We are trying to also strengthen the community health centers. For instance, maternity obstetrics unit in our community health centers are run by midwives. Last year, we introduced even ultrasounds so that we can have the best diagnosis of high risk at the closest area to the community, and quick referrals. So that is how we are also strengthening. And a lot of the equipment, even in clinics, have been digitalized, like the thermometers, the BP machines, so that we can also assist our health workers to do better. I must say, yes, we need to continuously monitor. If there are any challenges, we must intervene as soon as possible. I have issued an instruction to all CEOs. Any issue that affects patient care, if there is a problem, They must escalate, yes, through the bureaucracy, but also to myself.
Okay.
And I want to invite the public also to do that.
MEC,
Yes.
I think the public would like to do that. In fact, staff would like to do that too. And they apparently did, but you ignored them.
Yes.
And I'm going to put you on the spot here because according to the DA's Gauteng Shadow Health MEC Jack Bloom, the hospital CEO, Nomondo Maxeke ignored staff warnings and overcrowding in the neonatal ward was increased. The staff told them, they said there are too many, there's going to be a problem, there's going to be tragedies here. And then this CEO received political protection as apparently she's your friend and was only put on special leave on the 3rd of September. Is this true? Can you verify this for us?
Well, I think it is really sad for petty party narrow politicking on matters of health, on matters of human rights. But we have received the concerns from workers, and the head of department has put the CEO on special leave. She's much younger than me. I don't understand why she can be actually ascribed to being a friend of mine. She's a very young doctor who is very dedicated, like many others. But if ever there has been any mistakes, any negligence, she will be subjected to any other available measures like any other person. But I must say that I have visited the hospital several times as well. I was aware of the issue of shortage of staff, and that is why we have, it's not unique to Thelle Mogoerane, we have appointed over 2,000 new staff throughout our facilities. And at Thelle Mogoerane, also more than 45 nurses, professional nurses were appointed as well, and about 5 additional doctors. So we continuously respond to these requirements by all our health facilities.
Yeah. What about, you know, it is very difficult, and this is a conversation we can have for a very long time, because the stories that I get from people that go to the health facilities are stories that are, they really are, they're a very different picture to what you're painting here for us. When they go there with different ailments, there is no medication available. People have to lie on floors due to the overcrowding. The attitude from staff is something that they are also have to take abuse from, because, and people can understand when you work under circumstances where you are overworked, underpaid, and there is no equipment. I mean, you do become very, very hard to people that are desperate, and hospitals are facilities where people are ill and they are desperate. So I feel that the picture you're painting is very different to the reality of what is happening in public hospitals around South Africa. However, we got to wrap up because we're heading into the news. We need more hospitals, and this is something that is, I think, a fact. At least 6 more hospitals. Are we building these hospitals? What's happening?
Leanne, I have said this even before the Justice Maxeke Commission, the ADR process, that the Gauteng health system, the demand far outstrips supply, and that there are financial pressures, and we have not received any significant additional funding despite the high accruals that we've had. And within the resources available, I'm just saying our nurses and our doctors are our heroes and heroines. There may be those few that are not respecting patients and all that. We would like them to be called by name because they all have name tags, and we will certainly intervene. But by far, many of them are really saving our people. We have about 20 million patient visits in all our service platform on an annual basis. And yes, there is identified health facilities. I will be opening a new clinic at Hammanskraal. We have opened a new community health center in the Rand West last year. We continue building facilities, but certainly with hospitals, we will need additional money from national.
All right, we leave it there, MEC. We thank you for your time. Thank you so much for talking to us here on the program. We are trying to address the issue of overcrowding in hospitals. Also, this coming on the back of the death of babies from Klebsiella, 11 babies affected with the antibiotic-resistant strain of Klebsiella since the outbreak in July at the Thelle Mogoerane Hospital in Vosloorus, east of Johannesburg, and 6 having died from that. Dr. Gwen Ramakgopa is the Gauteng MEC for Health. It is 7 o'clock.